Hello and welcome to this new session in our Bone Matters series. Today we're talking about falls and how we can recognise we're at risk and, most importantly, take steps to reduce the risk of them affecting us. You may well be listening because you or someone you know has had a fall, or you may be worried that you're unsteady and worried that you may fall and break a bone. Either way, our aim is to increase your understanding to help you or someone close to you fill in the information gaps so that you can live your life with confidence without the fear of falling over and breaking something. We're very lucky to have three experts in the field joining us today. We have two professors and a clinical academic physiotherapist who are going to share a few slides with you and discuss common questions and issues you may have around the area of falls and what we can do to prevent them. I'd like to start by inviting you to introduce yourselves. Professor Masud, perhaps you'd like to go first.
Okay, hello everyone. I'm Professor Tahir Masud, also known as Tash Masud by many people. I'm a consultant physician in Nottingham University Hospitals and an honorary professor at the University of Nottingham. My clinical and research interests are in both osteoporosis and falls. And more relevant, I guess, is that I was the recent co-lead in the recently published World Falls Guidelines.
Thank you very much. And Julie?
Hi, my name's Julie Whitney. I'm a physiotherapist by background. I'm a consultant at King's College Hospital in London, where I run a falls clinic and look after patients living in local care homes. And I'm also a lecturer in long-term conditions at King's College London.
Thank you. And Professor Skelton?
Hello, my name's Dawn. I'm a Professor of Ageing and Health at Glasgow Caledonian University. Worked with Tash on the World Falls Guidelines and have done lots of research over the years into exercise to prevent falls and to improve bone health. I also, with another hat on, train exercise professionals and physiotherapists in working with people in the treatment of falls. So people who are at very high risk or who are very frail.
Thank you very much indeed, and welcome to you all. So can I start then, Professor Masud, and ask you to set the scene and tell us a little bit about the link between falls and broken bones?
Sure. So fracture actually is the link between osteoporosis and falls. So in order to have a fracture, the two most important risk factors are bone fragility, in other words, osteoporosis, but also the likelihood of falling over. And both are very important when we consider prevention of fractures. Now, falls are actually very common in older people. So above the age of 65, a third of people will have had a fall over the course of 1 year. If we want to prevent a fracture, we can, of course, treat osteoporosis by using drugs to strengthen bones, but we can also consider identifying and reducing the falls risk in individuals. Okay, now it's worth thinking about what causes falls. And actually there's a whole number of risk factors which we can call intrinsic and extrinsic. Now, in terms of person-related risk factors, virtually any disease system in any part of the body usually can lead to a fall in some way or another. The common risk factors might be, for example, in the cardiovascular illnesses. So, for example, if you have heart disease, previous stroke, rhythm problems of the heart, blood pressure problems, all these can increase your risk for falls. Then we have problems with the brain, including dementia, depression, and also what we call delirium or acute confusion. They are very important risk factors in older people for falling over. Then you have your a neurological condition. So if you have Parkinson's disease, for example, or neuropathy, this can increase your falls risk. And then we have problems with the musculoskeletal system, like joints, so arthritis, problems in the feet. These are very important risk factors too. Then it's important to remember that sensory disorders, problems with your eyesight and hearing, are risk factors as well. And in older people, any acute illness, for example, infections, they can also lead to older people falling over and being admitted to hospital. So a whole list of conditions that can affect older people can increase the risk of falls. And then, of course, it's not just personal related factors. We also have to consider the environment. So there are a lot of things in the environment that can increase risk of falling over. We call these, in the scientific jargon, extrinsic factors. And this may relate, for example, going from the top anti-clockwise, for example, low seats that people sit on. Chairs without arm support can increase the risk of falling over. Issues in the bathroom, for example, low toilet seats, slippery surfaces, the lack of grab bars. Dim lighting in the house can also increase your risk of falling over. Problems with the stairs, for example, windy stairs or stairs without handrails, these can increase the risk of falls. The type of clothing or footwear you wear, this can also have a major impact as well. And one of the most important extrinsic or environmental risk factors is certain medications and drugs. So let's talk a little bit more about that now. So I think the first thing to say is that the more the number of medications that you're on, in other words, too many medications, these can sometimes increase your risk of falling over. And it's worth thinking about that, especially, for example, if you start losing your balance or start feeling dizzy. It's worth just asking yourself, could it be one of my medications? And then it's important perhaps to have a discussion with your GP or your doctor and ask the question, could one of my drugs be contributing to the falls? And it may be that it's some simple things that can be done to try and reduce your risk of falls. Particular drugs to look out for might be drugs that are used for high blood pressure, for heart conditions, sedatives or sleeping medications, antidepressants, some drugs used for mental illness that we call antipsychotics, and some painkillers, particularly morphine-like drugs. These are all drugs that can increase your risk of falling over. So it's worth just asking the question. But I think it's important to emphasize that you shouldn't try stopping any of these drugs yourself without speaking to your doctor, because some of these drugs you might need to stay on for other reasons. And also some of these drugs you need to taper off gradually rather than suddenly stop. So it's really important that you speak to your doctor about that. So I wanted to particularly mention the issue of poor vision, because poor vision has been recognized as a very important risk factor for falling over. For example, in older people, one of the commonest conditions is cataract. And if you go to the bottom row, you'll see in the middle, this is the sort of a picture that you might see if you're talking to a woman, if you have a mild cataract. If you go to the picture on the extreme right, this is the sort of vision that you might have if you've got a severe cataract. And so I hope you can see intrinsically, therefore, if your vision is affected to this degree, that this really is going to increase your risk of falling over, tripping over things, for example. So it's worth bearing in mind that get your eyesight checked, and if there's anything correctable, that certainly should be done. Okay, and I think the last thing I will say is that a basic message is that preventing fractures really does need a combined approach. The first thing to do is to, of course, identify and treat osteoporosis to make your bone stronger. But it's becoming clear now that we must prevent falls as well. And we cannot just sweep falls under the carpet anymore. That's really important. I think I'll stop there and let Dawn carry on, I think.
Thank you, Tash. I think you've made some really important points there. There are many reasons for falls, but what we do know in terms of the evidence base to prevent falls is exercise has a really strong research evidence base. As a single intervention, it's the most effective intervention at reducing falls. And in terms of preventing fractures, we want to, as you talked about, it's not just medications for bone health, but there's also exercise that can help build bone or make sure that bone density is as good as possible. We can also potentially make a difference to the structure within bone with the type of exercise we do, Obviously, posture is key, and posture is also key for falls risk as well, because we know that people with stooped posture fall more, mostly because their centre of gravity is forward. But in terms of preventing falls with exercise, we know that strength and balance has the most evidence. So something that improves muscle, which also helps bone density, but also something which improves our balance. And then we have to think about the types of exercise which will help that, and ones which potentially increase our hazard exposure. In other words, something like skiing, where actually you're not always in control, other people are around on those slopes as well. So certain types of activity or exercise might actually not help falls fracture risk. We do know, however, that there are a lot of things we could do, not just for our reduction in falls, but also in our general health. And these all tie back into the physical activity guidelines for health, which can seem perhaps a little bit unachievable if you haven't been active for some time, because we're asking people for their health to be doing up to 150 minutes a week of something that makes us slightly warmer or out of breath. So that will help our cardiovascular system. But generally within that will also be any impact work which helps our bone density. We're asking people to think about building strength on at least 2 days of the week. This helps, again, not just for bone density, but also for balance improvements or for falls risk reduction. And we want people to think about doing something that will improve their balance on at least 2 days a week. And I'll talk a little bit more about some of the things that can do that in a minute. The last key part of those physical activity guidelines are to minimise sedentary time. The amount of time we spend sitting, reclining or lying down in our waking day. And that's actually what I'm going to start with, because the evidence is also key for preventing falls by moving more and sitting less. So the aim really we know to help improve balance is that people that spend prolonged periods of time sitting or lying down in their waking day, generally those that are frailer, but actually also people that have lots of hobbies that are seated, or people that work in an industry where they're seated a lot of the time. We know that they tend to have weaker muscles, lower bone density, they fall more, and they're more likely to be frail. So we want to try, first of all, with thinking about breaking up prolonged periods of sitting, being on our feet as much as we can. That's a really key part for good balance. Just before I move on to a specific information about balance exercise and things that can help reduce your falls risk, a reminder that for our bone health, in terms of bone density and bone structure, we want to be looking at thinking about impact carefully. There's plenty of resources on the ROS website for this, of course. We want to also be meeting those physical activity guidelines for strength and balance, and think about what strength work should feel like. Muscles should feel warmer and slightly tight if you're doing something that's going to improve your strength. And in terms of balance, you actually need to feel wobbly to improve balance. So a seated activity won't help balance, for example, but you need to be on your feet and you need to be challenging your balance so that your brain can use all those senses that Tash talked about a while ago, about your vision, the feedback from your joints, information from your inner ear. These things will tell the brain how you're moving, and will therefore work out what it needs to do to keep you upright. And it can only do that if it practices it. So we do need to feel wobbly in order to improve our balance. Just a couple of things to think about, and in terms of our staying steady type of exercise. We want to be doing this on a regular basis. In fact, in an ideal world, we want to do it every day if we can, something that challenges our brain to ensure it needs to practice to keep us upright. Tai Chi has a fabulous evidence base, and you may or may not have had a go at this, but Tai Chi is slow, three-dimensional movement in a variety of planes. So you're turning your head, you're moving your body in different speeds over time. And we know that there's a good evidence base for that in terms of preventing your first falls, that's for sure. Dance activities, sporting activities, anything that's playing rackets, anything that's making you run around or change direction is also a balanced, challenging activity that potentially could help future reduction of falls. Always think about, though, it's good to feel wobbly, but you need to also have something nearby, because what you don't want to do is fall. So you want something nearby that you can put your hand out onto or hold onto, or another person, for example. You might do that in dance. The other thing to think about in terms of balance work is that we need to ensure that, in effect, we're doing this on a regular enough basis that the brain is constantly having to practice. And so we also know we need to do it for a fair amount of time. If you've been avoiding balance challenging activities, we know that it actually might be up to a good few months of doing balance activities before you really feel suddenly, oh, I didn't need to reach out for that. I'm feeling quite stable in that. So it can take a little bit longer to perhaps to do. But the key thing to think about with exercise to prevent falls is if you are already falling, in other words, you've had a couple of falls, perhaps walking across your flat kitchen floor, nothing in the way, you can't blame anything for it, that means you probably need to think about some rehabilitation exercise. So going to somebody like Julie, who runs a falls clinic, who has specific exercise programs that will work fast at improving your strength and balance to make sure you feel stable enough to take part in all the other activities that you can do, which will continue the good work. The lady right in the middle of this slide, who's got her hand near a chair and standing on one leg, that's the sort of exercise you might get in a falls exercise program, where you're joining with other people, where you're concentrating on really fast improvement of balance. But if you are taking part in other activities that you enjoy, which is obviously good because then you're going to keep doing them, things like cycling do require quite a lot of balance skill to keep the bike upright and as you're moving and traversing around traffic, for example. Dance classes, as I say, will help with falls. But if you are already a faller, their evidence suggests that you need to be doing structured balance work that's progressive and supervised by someone who can help progress you safely. Running, again, a good balance activity. Things like golf, but again, beware, because if your balance isn't too good, that can knock you off balance. Something like, believe it or not, something like horse riding is really good for balance. But again, it's a very high risk activity, because obviously if the horse decides to chuck you off, it's not so good. So think about activities that, number one, you like doing, but that are also challenging you in 3 directions, 3 movements, getting your eyes, your ears to work hard, because these things will, in the long term, help maintain your balance so that you don't feel unsteady. And that's the key thing. For you to enjoy being active and getting out and about, you have to feel steady. So balance work is a key part of any activity program you might do. I'm going to pass on to Julie now.
Thanks, Dawn. I haven't got any slides here, so I'm just going to talk through a few questions that have been posed to me. And the first one is, and these are a bit around how you can help yourself in terms of preventing falls. So the first question that I was given was, how do you know that you're at risk? And are there any tools or tests to help you with this? Well, there are some simple ways of working out whether you're at risk of falling. Firstly, if you have had a fall, and certainly if you've had a fall in the last year, that in itself is an indication that you're at risk of falling. And particularly if you've had more than one fall, or if you've had a fall with an injury, or you've had a fall where you've had to seek medical attention, this suggests that you might be at high risk of having another fall. So if you've had a fall at all, it's really important that you mention this when you have appointments with healthcare professionals, or you even think about making an appointment with your GP to discuss that if you haven't already sought medical attention for that fall. Aside from having another fall, the other important risk factor Dawn's been discussing in detail is experiencing problems with walking and balance, or feeling that your muscles are weak. Now, walking and balance and muscle strength can be assessed by healthcare professionals, and there are lots of specific tests that can be done to look at this. So things like measuring walking speed, a healthcare professional observing your walking to see if there are any abnormalities with your walking, and also doing some tests to look at your balance. You could also do the following yourself. So consider whether you feel like you're walking slowed down. Do you feel more wobbly? Have you started using a walking aid, or have you started using furniture, or you're holding on to furniture a little bit more when you're walking around? And you can do a test to look at your muscle strength. So you can do this in your own home. If you get a standard dining chair, you need to be able to get up from the chair without holding on, without using your arms to push up. So ideally with your arms across your chest. And if it takes you longer than about 14 or 15 seconds to stand up and sit down 5 times, this suggests that you might be starting to be at increased risk of falling. If you have any concerns like this, do discuss them with your GP or healthcare professional, because as Professor Masud talked about, if you are at high risk of falls, it would be beneficial for you to be referred to have a more multifactorial assessment of falls risk, which would look at all those different domains that Professor Masud was describing in his previous slides. So the next question that I had was, what can I do for myself? So when out and about, are there things that I can do around footwear, around lighting, around vision? I would say when you're thinking about what you can do yourself to prevent falls, by far the most important thing has already been discussed by Professor Skelton, and that is to stay active, or to participate in exercise to build up muscle and improve balance. Or as Professor Skelton suggests, breaking up time sitting, so breaking up sedentary behaviour. However, in addition to that, there are some other practical things that you can think about. One of those is taking care of your feet. So your feet are the thing that connects you to the ground. If you've got foot pain, if you've got corns or calluses, if you're struggling to care for your feet, that can increase your risk of falling. So it may be helpful to see a podiatrist to support you with foot care if you're experiencing any of those symptoms. In terms of the footwear you wear, that can make an important difference to how steady you feel when you're walking. So you need footwear that fits you well, and it's securely fixed to your feet. So you might think about having footwear that's secured with laces, or a slip-on shoe, but a slip-on shoe that is very secure on your foot. You need to ensure the sole of the shoe is non-slip, but make sure the sole is not so thick that it reduces the sensation you get from the ground when you're walking, because that sensation is really important to help you adjust your balance and stay steady. Professor Masud's talked already about getting your eyes tested regularly. So vision not only allows you to pick up hazards, so to see to see an uneven piece of pavement and avoid tripping over it. Vision also is really key to everyday balance. So regular eye tests will of course pick up conditions such as cataracts, which we know if they're treated, it's quite an effective way of reducing the risk of falling. Some people find it helpful not to wear bifocal or varifocal glasses if they're walking out and about, if they're going up and down stairs. And this is because the reading bit of the glasses makes it difficult for you to pick things up that you might trip over. And there's some evidence to suggest that if you've gone to get your eyes checked and you've been given a new prescription of glasses, that you just need to be a bit extra careful in the time that it takes your vision and balance to adjust those new glasses. So it's just something to be aware of. And then in terms of lighting, Professor Masud again talked about in your environment how important it is to have good quality lighting. If you have a condition that causes a loss of sensation to your feet, then vision is even more important for balance. So you might want to consider things like thinking about how you cope in situations where you can't use your vision. So if you're getting up at night to use the loo, and having a night light or putting on a light before you get up is a way of reducing your risk. There's some evidence to suggest that getting your hearing tested and optimizing your hearing will be helpful. And Professor Masud's discussed thinking about your environment. And if you're finding things particularly difficult at home to navigate your environment, you're finding it difficult managing with day-to-day activities in the home, then you might benefit from a home visit from an occupational therapist to support you with making the home safer and reducing some of those hazards. And then the final question I had was about how you keep confident and reduce your fear around falling. Now, some people will have a fear or concern about falls, and they might not have even had a fall at this point, but just being concerned about falls actually makes you more likely to fall, sometimes even if you don't have major problems with your balance. And fear of falling can be very incapacitating. So it can cause you to be less active. It can cause you to feel anxious. It can affect your mood and your quality of life. So it's really important to address this, because you can see that if you start to be less active, you're then going to develop problems with muscle strength, and your walking won't be so good and your balance won't be so good. So it's really important that a fear of falling doesn't result in being less active. So there are a couple of ways to address this. So one way to address it is to participate in exercise to build your confidence. So the strength exercise and the balance exercise that Professor Skelton was discussing, doing that in itself is a way to build confidence. And some of the structured exercise programs that are delivered for people at a particular risk of falling, and the rehabilitation programs include practicing ways of getting off the floor, and often knowing and being confident about being able to get off the floor will help you feel a little bit more confident about how you would manage if you did have a fall. If the fear of falling persists, even if you're taking all these measures and doing the exercises, there is some evidence that cognitive behavioural therapies can help with that. Many people certainly in England, I'm not sure about the rest of the UK, can access these services through self-referral or through local health services. And if you can't do that, do have a chat with your GP, or if you have a physiotherapist that you're seeing. There is something called improving access to psychological therapies, which a lot of people can access themselves through self-referral to engage with cognitive behavioural therapies to help with fear of falling.
Thank you so much, Julie, and thank you to all three of you. I had a few questions I was going to sort of put to the floor, should they not come up, but they've all come up. So I wondered whether any of you wanted to say any more as a result of what's been said, or yes, Tash?
Yeah, I think I also wanted to make the point, of course, today we are discussing the context of fractures and the link with osteoporosis, but I wanted to make the point that actually preventing falls has a lot of other health benefits and other good benefits. So it's not just a matter of fracture prevention. It's also a matter of preventing other injuries like head injuries, dislocations, lacerations. But also, as Julie mentioned, you can develop fear of falling. A third of older people, when they've had their first fall, develop this very important syndrome, concerns about falling. And so what Julie said was really, really important. And if you can prevent that, that's much better. And also, falls can lead to increased admission into hospital, of course, which can have devastating consequences. But also, a fall is sometimes the start of a cascade of events, which eventually leads an older person to end up in a care home. So there are lots of other good reasons why we should try and prevent falls, other than preventing fractures as well. I think that's really important.
Yeah.
I've got a bit more for you, Julia, as well. I mean, the range of activities that can potentially improve balance varies dependent on a person, what they can do at that point. So if you've got someone, if you're a person who is quite happily going out and playing tennis, then you're not likely to benefit from a specific falls prevention program, run by the NHS or in the community. That level of balance challenge you're already doing in your playing tennis. But then if you've got to the point where you do want to stick when you're outdoors, or you furniture walk a little bit indoors, or you think, do you know what, I'm not going to go to that particular activity at that club because it's got an uneven pavement going on the way in. If you're starting to think like that, that's the point at which you really could do with not just trying to necessarily be more active, because you're obviously avoiding activity through concern. That's when you need to seek out the help of a falls clinic or a falls practitioner that can just hold your hand through it. Everyone is all about making sure that we add things in that help people at the time point at which they need it. But if you're at the point at which you go, if I really think about it, I'm only starting to avoid the really challenging things, like I wouldn't walk on a balance beam anymore, perhaps, but I'm okay in just wandering about and not needing a stick. Then you need to think about other things. If perhaps joining groups isn't your thing, or you're perhaps can't afford to go and join a gym or any of those sorts of activities or a class. A really good way of improving balance and having something nearby if you need it is bus surfing. So getting on a bus or a train, standing up, but being near the handrail for you to, or two handrails, and actually, because your brain is going to work so hard at keeping you upright and on that sort of activity. So if you want embedding something into your everyday life that constantly challenges your balance is a great way of keeping you not needing that specific physiotherapy input or specialist exercise instructor input. When you're doing a teeth in the morning, stand on one leg. Because if you will have to put your foot down because you're doing, you're making yourself move, you're moving your head, etc. But even perhaps try doing it with your eyes closed. These sorts of things will make you feel wobbly. As long as you do them safely, your brain will be working really hard at using all those senses and then using all the muscles that it needs to keep you upright. We learn as children to stay upright by falling over. Yeah. So if you think about children, so we shouldn't be fearing the fall, and we should get to the point where we go, okay, well, you can all fall. I'm sure if you ask the three of us, at some point we may have had a fall in the last year. It's just not going to be one that perhaps a frailer older person, the type of fall might be different. But the point I'm getting at is that at some point, particularly as Julie said, if you are not worried about getting up off the floor, and if you've practiced that, it goes back to how you and I might feel about not being worried about falling, because we can get up. And so really, I suppose the point I'm getting at is that we can start over time to start avoiding things and making things a little bit safer, and people start doing things for us because they think they're being helpful. But actually, it's a use it or lose it, and the body needs to feel wobbly on a regular basis in order to be able to correct that trip when it comes. And so that's the thing to do, is embed some of that, if we can, into everyday life.
Lovely. Yes, Tash.
So I think the other issue I wanted to mention was healthy aging in general is very important. Julie and Dawn have already talked about the importance of physical activity and exercise, and that's really, really important. But there are a few other important things as well. And one of them, in our context particularly, is a good diet, particularly protein. That's really important. So there are conditions that we talk about as experts called frailty and sarcopenia. Frailty is when you become vulnerable to stressors, that can make you fall. And sarcopenia is where you get loss of muscle mass, but muscle function as well, and muscle strength. And that can also increase your falls risk. And apart from exercise and physical activity, the other important issue there is protein. And we know that as you get older, your body's ability to make protein gets a little bit impaired. So you actually need more protein than when you're younger. So having a good diet with plenty of protein is really, really important, as well as the other aspects of good diet. Your 5 a day, as to reduce your sugar content, to improve your fiber. So it's worth thinking about the type of foods, for example, that has a higher protein and a lower sugar content. So, for example, as well as fruit for antioxidants, reduce your cancer risk, for example, Nuts are very good. Lentils are very good for protein. So these other type of foods can be supplemented to your normal diet to try and increase your protein intake. And it's very easy now these days to check the protein content. So the World Health Organization say for adults, you should have 0.8 grams per kilograms of protein a day. But we know now for older people that needs to be increased to, for example, 1.2 grams per kilograms per day of protein. And it's very easy now to check the protein content of food when you buy it. So I think that's the other thing I wanted to make. And I think one other important aspect is that about the exercise and physical activity, people think, oh my God, I'm going to have to join a gym. No, you don't need to do that. You just need to plan your day. If you're getting off at a bus stop, get off a stop before your destination, and that makes you walk. And you can then add that up to your 150 minutes a day. So simple things like that can really be helpful as well.
Thank you. Julie, did you have something else you wanted to say? Yes.
Yeah, I was just going to just returning to the self management. If you think that you would benefit from engaging in full services, then the way that full services are configured is quite different depending on where you live. So I can't necessarily give you a definitive sort of signposting as to how to find your local full service. Some in some places there will be falls clinics that are either run as a hospital outpatient clinic in your local hospital, or if you have a community hospital, they might be run there. And in other instances, falls clinics and falls services might be community led, so they might be in a GP practice or in a community health centre, or even a service that comes and visits people in their own homes when that's indicated. So there are lots of different ways that you can that full services might be accessed. Probably the simplest way to know where your local full service is through your GP surgery. Because the GP surgery will know what that is and will regularly make referrals. And if you're concerned about your falling, of course, hopefully you will have been to see your GP about this anyway, because your GP is a really important part of this whole process. If you wanted to look at what services are available, you can go in England. There are the integrated care systems where you can, which will have websites that will tell you what services are available, or your local hospital trusts or health boards. Dawn might be able to help a little bit more with what happens in Scotland.
It's quite similar, to be honest. The easiest way, if you have access or know someone who does, is that you just Google full service in your town, and you'll find normally there'll be a little list. 9% of the time, the first one that comes up is a national health service run, or a community public health service run one. But it might also then bring out other individual classes, if there might be some private classes available locally. So I think the best bet is the good old internet, if you've got someone that's got access to that. But also I would encourage you to look at fallsassistant.org.uk, which will be in your resource list, because this allows you to work through your own individual risk factors, produce your own little plan of action, which might include contacting a GP about going to a full service, but it also has the ability to check your own balance with a couple of tests and a couple of very simple home exercises to improve your balance. So that's a great place to start. Of course, the ROS has some really good videos and exercise leaflets as well on improvement balance as part of the strong, steady and straight statement. And I guess the only other thing I just didn't want us to forget is hydration. I mean, we may not have had the warmest summer in Scotland, but I believe everybody else has. And hydration actually can also lead to falls. If you're dehydrated, nothing works as well. The brain doesn't coordinate all their senses as well, and particularly your balance can be affected. So do remember to stay hydrated as well, as a final point, I think.
Yeah. And if I might just make another couple of tips, which I got this passion for promoting healthy aging. So another couple of tips. So Dawn made a really important point about we're learning more about sedentary behavior. And so she talked about reducing your sedentary behavior. So if you're sitting in front of a TV or lying on your couch watching a film, just put the stop button on every hour, every half hour. Just get up, go to the kitchen, get a glass of water to stop yourself dehydrating, and then come back and carry on. I think even little things like that can be really helpful as well. So just simple things. And one other tip is that we should encourage people to use the stairs more rather than the lifts, because climbing a flight of stairs is actually very good for muscle strengthening, for your thigh muscles, and that per se can also reduce your risk of falling over and so on. So we need to encourage people to do the stairs rather than just get the lift up. And I think that's another good tip for a healthy aging.
Wow, thank you. What a great practical session. Thank you so much, Tash, Julie, Dawn. It's been amazing. Sadly, we're going to have to bring it to a close. I think we could go on and on, but we kind of ran out of time. But so thank you so very much for sharing your knowledge and your understanding. And thank you to you, to our audience. Couple of quick pointers before you go. Don't forget to check the resources that we're pointing to below that have been mentioned throughout the sessions. And also don't forget to sign up to get alerts to find out when the next Bone Matters session will be. So for now, thank you very much to you three, and we'll see you at the next one.